Hello, my name is Rakesh Sharma and I'm a consultant cardiologist at the Royal Brompton Hospital. We're now part of Guy's and St Thomas's NHS Trust. So I've been very fortunate to be able to work with patients with cardiac sarcoidosis over the last 15 years. And we've been asked to put together this video by the SarcoidosisUK charity. So we'd like to introduce Sue Gilmour, our specialist nurse, and also Alex Louie, who's our senior registrar for the service. So Sue, can I ask you to begin with your experience in helping support patients with cardiac sarcoidosis over the years?
Hello. So I basically put it down to a few categories, where the first one was medical and healthcare, which is about diagnosis, treatments, investigations and prognosis, which is largely covered by others this morning, and then also psychological support. And it may be appropriate to do a self-referral to IAP services, which are local low-level mental health services for CBT, if patients are struggling. There's also support groups which may be useful, which can be accessed via SarcoidosisUK. And then also with managing emotions, with the grief of a diagnosis, a serious health diagnosis. And then you can also do other interventions like mindfulness, meditation and yoga to manage these emotions. We'd also thought about financial implications with regards travel insurance, the ability to travel, and mostly travelling to countries with good level of public health services that could be accessed. And there may be some life insurance or mortgage implications that are important to patients. There's also the ability to access welfare and benefits advice, and then life and employment issues. Do you need to tell the DVLA if you have sarcoid? Do you need to tell your employer? And it's also important to be aware that you are entitled to ask for reasonable adjustments in line with the Equality Act, and that these may include more working from home, avoiding large-scale meetings to reduce the risk of infection if you're immunosuppressed. Thank you.
Thank you, Sue. So you mentioned the DVLA, and actually one of the common questions that we get asked as health professionals is what the implications are for patients who's had a device implanted. So many of our patients will require a defibrillator to protect them from serious rhythm problems. And in this situation, Alex, what do patients ask you about the implications, and what advice can you give them about the DVLA?
Yeah, thank you, Dr. Sharma. In the cardiac sarcoidosis patient population, cardiac devices are very common, and we get asked quite a number of questions because it can be perceived as a major change in your life, having a defibrillator implanted. First thing to say is that this is normal. A lot of patients have the defibrillators, and living with it, as long as you are careful, you can have a good lifestyle. The important things to think about, first of all, with the defibrillator is that if you are on immunosuppression, so look out for any signs of infections in and around the area, and if you do see any signs of infection, to seek medical help immediately. The second thing to note about defibrillators is that when it first is implanted, you cannot drive for a month, and this needs to be informed with the DVLA. And if the defibrillator ever were to kick into action in the future in terms of therapy or device shocks, then you should also contact DVLA and obviously your medical team with us, that you cannot drive for 6 months. But the important thing to remember that we're always here with you if you need support, and there's always a lot of information out there for you to seek as well. You're not alone.
Yes, and with defibrillators, one of the advantages is that with technology and remote monitoring, we can actually look after patients in their own home remotely from the hospital. So if there's any device trigger or rhythm problem, we get to know about it in the hospital, and then we can contact the patient and the local services. Now, cardiac sarcoidosis is much rarer than other forms of sarcoidosis, and as a result, it's important that the condition is managed in centres which have the expertise. Now, one of the advantages we've had following the pandemic is remote access and remote clinics, and this has enabled us to be closer to our patients because patients don't have to travel all the way to our hospital to see us. They can log in from the comfort of their own home. And also we found that specialist nursing support is also more readily available to our patients through Sue's expertise, because very often local cardiac centres do not have the the expertise in cardiac sarcoidosis management, which is quite specific. So, Sue, did you want to talk about your own experience in remote clinics and how that's changed the way we manage our patients?
Thanks, Rakesh. So one of the ways that it's particularly changed our practice with heart failure nursing is the ability to optimise patients' cardiac medicines from far and wide, because often local services only accept patients with more severe LV impairment, that's left ventricular systolic impairment, and many of the sarcoid patients are picked up earlier in the disease trajectory with mild impairment, and previously they were not accepted by local services, and they often fell through the net because they couldn't access ourselves because we were running an entirely face-to-face service. So that is one of the improvements of the pandemic.
Thank you, Sue. So obviously it's a very short video just to kind of introduce the services available to you. The SarcoidosisUK website has a wealth of information which you can access. We do hold regular annual patient information days, and you can access all the videos from those information days on the website. The charity also has a support hub, a nurse helpline, and they can enable you to connect with other patients with the condition through their Facebook page. So do get in touch. Thank you very much.